based off of the BMI metrics. And so I don't like using the term obesity. I'd rather use the term over fat because that is what is actually the root cause for a lot of the health issues that was brought up in the presentation. The other thing that we'll touch a little bit on as we go through the series of episodes here is there's a lack of historical understanding as it relates to body image and what we look at as being ideal, air quotes around that, for what ideal happens to be, because ideal is a sociological measure of beauty, and that sociological measure of beauty changes based off of what we would view as uh, societally or socially appealing. And so there's a lot of kind of changes of perspective in terms of what we would consider to be ideal, what we consider to be beautiful, and what we consider to be aesthetic in terms of body image. And that leads to a whole host of body dysmorphic problems that come about. And a couple of things that came out recently in terms of, and by recent in terms of sciences within the last 5 years, um, has been a understanding of the impact that electronic projections of body image has had on understanding of body image. I know that Mikhail and I have talked about this previously off recording, the fact that actors and actresses have a lot of body dysmorphic issues that come out, and that has to do with the fact that they're taking a three-dimensional object and then squeezing it into a two-dimensional, so they're flattening everything out. But then at the same time, they're trying to have a body image that meets what the producers are looking for, which is why we see a lot of actors and actresses, however you want to gender label that, have in terms of their body image, and the fact that they will undergo, as we talk throughout this discussion here, a lot of body dysmorphic eating behaviors, anorexia. Perspective. If I was raised in a Mediterranean household, everything's going to be ethnocentric towards that perspective. And one of the things that we don't appreciate within all of the perspectives that are out there is that we don't appreciate that ethno part of
Oh.
all of the cogs within this. And part of that goes into the historical perspectives.
Mm-hmm.
And historical perspectives and sociological perspectives, go to any of the fine art museums
Mm-hmm.
and look at the portraits that are on the walls. Those are what we would consider and deemed to be beautiful.
Right.
You can think about it as like the supermodels,
Yes.
and compare body image.
Yes.
All of those images we would not consider to be, based off of our current, the quotes around that, ideal of beauty, to be beautiful.
Right.
We would consider them to be slightly fat,
Yes.
leaning towards overweight, leaning towards obese in terms of the common vernacular, in terms of the common words.
Right.
And so there's a reason for that. And the reason for that is because people who had time and money had the ability to eat more food than people who didn't have time and money.
Exactly.
And that became the ideal of what I wanted to be. If we look at, and this goes into particularly for the female image,
Mm-hmm.
we become more accepting of female image across a spectrum recently.
Yes.
But if you look at the supermodels before we started doing the body positive
Yes.
advertisements, and you compare it to what we refer to as an andrificated body,
Mm-hmm.
women who are on the within the duality of gender groupings. So remember,
Yes.
gender groupings is not one big curve, it's two curves that kind of overlap,
Yes.
where you have the female curve, you have the male curve, however, whichever
Right.
side you want to put those curves on.
Yes.
You have females that trend towards male, and you have males that trend towards female, and you have males that trend towards male, and females that trend towards female in terms of body image, in terms
Right.
of morphology, in terms of physiology. A lot of the female models that we would put on covers of magazines, independent of Photoshop and independent of any type of photo editing, are androfied body image.
Yes.
Short torso, long limbs, broad shoulder, narrow hips.
Yes.
That is 5% of the female population.
Perfectly obtainable, you know?
And so that's not ideal.
Yeah, exactly.
But what happened is that what got accepted within the last 2 decades and got pushed forward within the last 10 years or so
Hmm.
is the willingness to accept female body images that did not match the supermodel body image, particularly
Right.
amongst the advertisers.
Yes.
That has not happened for the men, though. For the men, it's actually gone
No.
backwards,
Really?
even with the acceptance of the quote unquote dad body.
Really?
Yeah, so the dad body is the male that has slightly more adipose
Yes.
tissue.
Right.
Look at the males in advertisements versus the
Yeah.
females in advertisements.
Oh, I I didn't even consider to look at it on that level because I mean you're right with the body positive thing. The only time I ever hear anyone talking about it, it's usually women, whether it's
Mm-hmm.
on social media or whatever, it's all female centered.
Yep.
It's there's I